My greatest pleasure to welcome this morning Dr. Nicole Harder. She is an assistant professor, College of Nursing, and the Mindermar professor in human simulation at the Faculty of Health Sciences at the University of Manitoba. Her position includes simulation-based education and research for the College of Dentistry, Medicine, Medical Rehabilitation, Nursing, and Pharmacy. Nicole's current work is creating, implementing, and studying the use of psychologically safe debriefing frameworks following expected and unexpected patient death in simulation and clinical experiences with healthcare students and practitioners. Nicole is also the editor-in-chief for the peer-reviewed journal, Clinical Simulation in Nursing, and serves on the board of directors for the International Nursing Association of Clinical Simulation and Learning, and with the RESO Simulation Canada Network. She's also an educator for the Canadian Association for Schools of Nursing and the Simulation Nurse Educator Certificate Program. Thank you, Nicole.
Thank you. So thank you, everyone. I think quite a few of you I met yesterday, so it's great to see some familiar faces. What I thought I would do today is, we always talk about let's do simulation, let's do simulation, let's do simulation. And it really does take a team to run that. So what I wanted to do is spend a bit of time kind of talking about the who's who in the Sims do. Because one of the biggest things I found, especially even though I'd been doing simulation in just nursing for over a decade, when I started doing it more as an interprofessional kind of activity, I started to realize that there really were a lot of different kinds of moving parts that I hadn't always thought about. And so just sort of breaking those down and seeing who was probably the best person, depending on what you were trying to do in your simulation activities. So I probably am missing some people, but there's still quite a few that I'll have listed here. And by all means, as we go along, just interrupt me. We can talk. I have no problems with that because I like to go on tangents sometimes anyway, so it kind of works out well. So what I wanted to kind of objectives is look at how the experiences unfolds right from the design to the very end, because we often focus on the intra-sim without necessarily thinking about all the other parts that go along behind that. Who's in there, their roles, how they're all involved, because really we're talking about everything, like I said, from the very beginning when you're designing it, or it's just a thought, and then right on through to evaluation. How the roles, different kind of roles, affect the learning experience, and it doesn't matter if you're looking at students or if you're looking at practitioners, these all have an impact. And then just how you can make the most or maximize the impact of the roles that have on creating effective simulation learning. So that's kind of my lofty goals for today. And like I said, if you're involved in this in any way, I mean, by all means, please do share your experiences. So simulation is not new. I mean, we've talked about this ad nauseum. We've been using it for a long time. I mean, if you really go back even to games of chess, those are essentially simulations on war. Well, initially it was used for war. But, you know, in the health sciences, we've gone through, you can see birthing simulators that are from the late 1800s. We've got all sorts of kind of weird sort of contraptions that we've been working with. When we talk about computerized simulation, then we're talking more in the 60s when we used to have the big computer frames and these very expensive mannequins. And as time changed, technology changed, but especially expenses changed. And so people started to use them a lot more. But what was happening is we would have the tool, but we didn't necessarily understand the pedagogy. So as things were changing and we started to implement more of this, that's when there became a more concerted effort in looking at, okay, so how do we actually learn in this simulation environment? And I kind of mentioned this yesterday as well, but the interesting thing is that because we were introducing something new to an education environment, we always had to say, okay, so should we care? Why should we change? Show me the evidence, show me the evidence, show me the evidence. And so we started looking at having copious amounts of evidence, whether it was from education, research, from practice, that evidence that simulation was effective as a teaching and learning pedagogy. Which is interesting because we don't really have that for a clinical environment or for the classroom environment. So that's an important thing to kind of think about. So as that expanded, it became a lot more of a focus into what we're doing in simulation. And so other people started getting involved. Students have a lot more of maybe a voice than they previously did in terms of what they do and don't want as far as an education program. Faculty, sometimes we're happy to change, sometimes not so much. But, you know, we all also obviously have a role in there. Researchers, we need to do some kind of evaluation. Administrators, the ones who control the purse strings. Everybody has a different role in developing and implementing simulation. So that's what we'll kind of go through. All right. So usually it comes with, you have a plan. You're going to implement simulation. And that's as far as you get. So all of a sudden you implement simulation, and it's the now what. And I know that most of you are probably ahead a little bit beyond this, but when you're still working with new programs or programs that are newer to simulation, they might need a little bit more supports in terms of what they are going to do. Because often we say, okay, we want to use a simulation. Or I even have faculty that will say to me, okay, I want to run a simulation on X. But they're not really thinking about, they're just thinking about the scenario or the intra-sim, not necessarily everything else that goes around that. So that's an important thing to kind of think about. It's great to have a plan that you want to implement sim, but you've got to go beyond that, figure out who's going to be involved in this. All right, so only a couple things to think about. So you say, I want to run a simulation. Great. So you've got to think, okay, so who's going to be involved in this experience? Is it going to be with practitioners? Is it going to be with students? Is it going to be with both? Who's going to be designing the simulation experience? Is it going to be the practitioners? Is it going to be me sitting in a little office? Who's going to develop everything? Who's going to get the equipment? Who's going to hire the staff? Who's going to create the templates, make the charts, et cetera, et cetera, et cetera. So in other words, there's so much that goes into running a simulation. And this is probably not even everything that you have to think about. So as you can likely tell, especially if you've been a one-person sim show for a while, it can be quite challenging and very tiring because you're always doing everything. I mean, for me, the thing that I really, really don't like doing is I do not like making charts. I will give that to anybody and everybody else because it's tedious, and then there's always something you miss, and you're halfway through a simulation, and then it's like, oh, this doesn't match up with that, and you're like, oh, I thought I changed everything. So you kind of come up with your workarounds. Like for us, the date is always today. I quit putting dates on things because things change, right? If you have multiple groups that are coming around. And so it's things like that you're always trying to think about, okay, what else do I need to think about? Because there's always something more that you haven't initially planned. Or even if you're going through sims, I'm sure some of you that have run that, your participants will go left when you thought they'd go right, and you have to decide, do I want to go with them on that, or are we going to, see how this plays out, or do I want to try to redirect? So a lot of these things you can try to plan ahead of time, but other times not so much. So there's just a lot that you have to think about. So right at the very beginning, and these are essentially following through standards of best practice. Going through, these are just sort of the phases that you want to attend to. So the first one here, needs assessment. This is really, do you even need to do this? So what are the needs for your program? What are the needs for your department? We all have our own special favorite things that we think that we need to educate people on, but maybe that's not necessarily the case for everybody. So you do have to do a little bit of a needs assessment. So what I had done recently with my faculty is, even in terms of needs assessments, well, first of all, I had to figure out who was even involved in SIM. Like I said yesterday, we have over 1,000 faculty members, and so I didn't even know who was involved. And so were they involved in education? Were they involved in research? If they were in education, what kind of education? So it was with postgrads? Was it with undergrads? So kind of going through all that. So once I figured out even who was involved in simulation, then we had to start to kind of compartmentalize people, not silos, but say like the pediatric group, they might have something very specific that they want to do that's different than an undergraduate nursing program. So we kind of had to look at that. And even in terms of the scenarios with our undergraduate nursing program, we had to create lists of what was something that every student had to go through, what were things that were nice to go through, and then sort of their specialty projects. So sometimes we'll go with what are called the high acuity but low frequency events, or did we want to go with the high frequency, low acuity events? So we kind of had to have a mix of that in terms of what we wanted the participants to go through. So once you've decided even what you're wanting to do, then you start to have to look at, so what are your objectives? So again, I talked about that a little bit yesterday, but you could have the exact same scenario, and I'm a fan of this because you don't have to make new charts, but you have the exact same scenario, but you have different sets of objectives. So the first time it's on team communication. Second time it's actually on maybe on the clinical outcomes or whatever it is that you're wanting to do. But essentially by whatever you want them to focus on, that's what you have to have for your objectives. So one of my favorite objectives, this is being a bit sarcastic here, is where people say, I want them to care for everything. Care for the patient with whatever. It's like, okay, that's kind of big in 15 minutes, or 20 or 30, depending how long you run your sims. But that's kind of unrealistic, right? And so you have to take into account what exactly do you want them to do in this. And then I don't know if you do this, but we let our participants know what they're walking into. That's to ensure psychological safety. I don't tell them exactly what they're going to do, but you give them a bit of an idea. Because even in clinical practice, you know sort of what you're walking into. It's not a complete surprise, unless you're in emergency, of course. But for the most part, you have a bit of a history. So we need to provide that for our participants as well. It's not until then that you start to actually create the scenario, create the story. And so that's what I was referring to yesterday, is that it's going to be not your first step, but it's going to be, second, third, fourth step. Because often we jump right to, I want to create a scenario on heart failure. I want to do a resuscitation scenario or whatever. So rather than doing that, take a step back, have a look at what you're going to be doing, and then start to implement this scenario. Fidelity and leveling. So this is, how realistic do you want it to be? It was funny, when I was chatting with the physio group yesterday, we had quite a bit of a discussion about fidelity. And fidelity essentially is, we often think that if you have a high-fidelity mannequin, that you have a high-fidelity simulation. But if you have a high-fidelity mannequin and it has all the bells and whistles, but you're doing a mental health scenario, that's not high-fidelity. That's a high-fidelity computer technology, but that's not the right realism for the kind of scenario that you're running. So you have to think about that as well, as what is the right tool for the job. Because sometimes it might be that you just need very, very little. You might just need a task trainer. You might just need, a role play might be the right kind of thing for that. But you have to think that through, because most of us do not have limitless resources that are at our disposal. And leveling, often I find the lower level participants or students, usually the bells and the whistles and the fidelity, it gets lost on them. It's too much. They're reacting to the technology, not necessarily to what's happening in the scenario. And so you kind of have to play that by ear in terms of how much experience they've had with simulation and where you want to throw them into that. But what was funny is I was chatting with when I was chatting with the PT group, I was telling them I had a sim operator. So we always run our simulations in tandem if they're computer or they're mannequin based. So there'll be myself, who's the sim facilitator, and then the operator, who's kind of controlling the technology and the voice of the mannequin. And I'm sure you do this as well, because it's really hard to run the scenario and the technology and watch the participants at the same time. It's too hard. You're going to get lost in that. So I had a really good sim operator. He was a lovely young fellow from Australia, and he was my sim operator for my pediatric scenarios. And so he was supposed to be an 8-year-old girl. I didn't do that. Promise. So I'll finish off with my story. But so he was supposed to be the voice of an 8-year-old girl, and he usually started off pretty good. He'd like, "Oh, hi, my name is Anna," and by the time he was done, he was back to normal. And so the students would have gone through 3, 6. They would have gone through 18 scenarios with him and with me, and at the very end, that's behind a one-way mirror and everything else. And at the very end, I said to the students, I said, "So did you guys notice anything about Anna?" And they said, "Yeah, well, the voice was a bit distracting at times. It was supposed to be a girl, but really is a guy," and everything else. But then at the very end, and keep in mind, I'm talking to 240 students. I said, "Did any of you guys notice that he's Australian?" No. And I'm thinking, okay, that's interesting. So they said, "He's not Australian." I said, "Okay, Luke, come on out." So he comes out and he does his, "Good day, mate," kind of thing. And because he's literally, had only been in Canada for maybe a month or two. And what was interesting, where I'm going with that, is that they were so focused on what was happening in the scenario that those kinds of things were lost on them. They weren't focusing on that. They didn't even notice that kind of stuff. So we often try to put lots of bells and whistles in our scenario. When increasing the fidelity, we create these very realistic environments. But honestly, sometimes you don't have to. If that's not what the purpose is, if you don't need them to interact with that, I mean, perfect is if you can do it in situ, then you don't have to moulage anything. You just kind of wheel on in and do your stuff. But not everybody has the ability to do that. But it was very interesting just to see what the students respond to, because if you have all this equipment, I had some facilitator who wanted to have all the respiratory possible things they could ever have in emergency situations. Okay, well, it sat there. It sat on the wall. No one ever touched it. It looked pretty, but I probably could have just put a picture up instead of trying to gather all this equipment. So those are the kinds of things that you have to think about. Too many times we go a little bit overboard in that, but just think about what's the purpose of what you're trying to accomplish. Then we get into the actual student involvement with some of the activities, is the pre-briefing and the preparation. Now, this is where you have to really start to look at what you're doing. And what I mean by that is we had done, like I said, we had replaced 25% of our clinical hours of simulation. And part of our evaluation, we hired someone from, who was a PhD in curriculum evaluation. So not a nurse, not a doctor, not anything health professional, but an expert in curriculum design. And one of the things she did is she looked at our pre-briefing and our preparation materials for the students. And she said, right off, you're losing them right off at the beginning. With the language that we were using, some of it she said was actually a bit pejorative, so we kind of, that's not a good word. But even in terms of trying to establish psychological safety and get the buy-in, right from the beginning, there were some things that we were losing. This is especially with our new students, we were losing them in. So you have to really think about what are you doing in terms of the materials you're providing for them, how you're preparing them for simulation, and how you're even, when you first do that first pre-brief, when they first are introduced into the scenario, or into the sim lab even, is how are you preparing them for that? Because what you really want them to do is to respond to what's happening in the scenario, not the environment, not the technology, not you, not their peers, but to what you've created for them in terms of a learning experience. So there's a lot more research that's been going on into pre-briefing and how you can create that psychologically safe learning environment. I had a grad student who was working on this and created this great little cartoon video that we have as part of our faculty development to try to continue to get people to create that solid foundation when they start doing the simulation. Then you get into the facilitating simulation, which is why I was even looking at the table of contents of your book there, is because facilitating, you can do one of two things. There's the whole concept of prompts and cues while you're in sim. Often when you are working with new students or new practitioners, you might prompt and cue them a little bit more because what they lack is experience. And so when you are, and we all, see, and that's just it. We all know simulation is not real. I know it's not real. They know it's not real. We all know it's not real. And honestly, there are some things that a simulator and a simulation just can't do. And so what you're asking participants to do is to make those links, is kind of to do the make-believe of those in-between parts. With new students, you have to fill it in some way, somehow. And so it might be prompts and cues while you're in simulation with, like, oh, I feel all of a sudden really itchy, because you can't make a mannequin itchy. I can't all of a sudden make a rash appear, but you'll say things like that. Whereas your practitioners, they can kind of make those conclusions a little bit quicker if you're just kind of giving like a few prompts and cues, or if you have a confederate in the sim, you can kind of use them to do that. But you have to really decide how much you want to do that with them. And so, like I said, with new practitioners, it tends to be a lot more. If you're doing things like OSCEs, obviously we don't do anything, we just sit back and watch. But with you, if you're trying to do something that's for an education purpose, even with practitioners, we tend to prompt and cue them quite a bit less, but still have a few things on that you, especially if you've run the scenario before and you know that they're going to take the wrong turn at some point. If you want them to really focus on one thing, you have to provide the direction some way, somehow. You can't leave them to guess all the time. So that's a lot more preparation than what previously I probably would give. In the past, I probably just, honestly, I would wing it and say, oh, let's see where this goes. And that's because I didn't know. I didn't know where we would go. It's, now I pilot my scenarios before I didn't. And so it's things like that you just have to try to plan these things out. If it's for education purposes, especially for an undergraduate curriculum, then if you want people to have like for us who replaced clinical hours, we have to have a standardized process and say every student will participate in X. When we do things with practitioners, we have a little bit more flexibility in terms of that because it's based on the unit and based on whatever it is that we're doing with that particular group. So it doesn't have to be as standardized in those cases. Now, the debriefing, there are many, many, many models that are out there, but they all kind of follow the same process. They all have a reaction phase, they have an analysis phase, and they have a summary phase. But when you're looking at that, it doesn't matter what framework you're using, but ideally you would have a framework. So that way then your participants know what to expect. So I think of my fourth year students, even the end of third year, because at that point they'll have gone through 60, 70 sims, they can self-debrief before we even get to the room because they're so used to it. They know the process, they come in, they give me their ticket to sim, they do their prep. They've already assigned each other roles before I even say anything. And they're even, outing out their peers like, hey, you haven't been active in this role for the past bit and it's your turn, off you go. And then with the debriefing, they're doing the process. And that's because they have a lot of experience, and then we follow the same sort of structured framework so they know what to expect. And the reason that's important too is we often talk about, we want our students, especially new practitioners, to be self-reflective. So what do? We say, be self-reflective. Okay, sure. I don't know what that means, but I will try. The nice thing is that when you're going through a debriefing all the time, essentially what you're doing is you're asking them to reflect. And so if they're starting to use that kind of process at the end of any clinical situation, let's start to use that also in clinical practice. So they're starting to we actually are showing them how to be a self-reflective learner. Sorry, a little tangent here. Even last night I can't remember her name, that nursing clinical instructor, Jenny, right. She was talking about critical thinking, but one of the interesting things I say to my students is they'll say, well, I don't know what to do. Well, exactly. So what do you know? You know a little bit of this, a little bit of that, a little bit of that. Take what you know and apply it to that clinical situation. That is critical thinking. And so when you can kind of tell them what you're doing right now, that's critical thinking. It makes the invisible more visible to them. And those are the kinds of things that we're able to do when we're in a debriefing process. So that's why you've probably heard this many times, debriefing is the most important part of SIM. And that's because that's where we're kind of tying everything together. If you go through a clinical experience and you don't debrief, you have no clue what they're taking away from that experience. They might take away like, I hate SIM, which is the case for some people, and that's okay. But here you're really trying to create other kinds of learning patterns for your practitioners and your students. So that's a really important one. Now, not all debriefing frameworks fit all clinical situations. And so that's something that you also have to think about because that's where I was going with yesterday, is saying that when we have emotionally stressful clinical events or clinical scenarios, especially death, expected or unexpected patient death is on the top of that list, a debriefing framework that follows a debriefing process that follows an education framework that looks at learning outcomes is not enough. We're not interested in learning outcomes. We're interested in being able to process feelings and emotions and those kinds of things. So you do have to change things a bit depending on what your objectives are for the simulation. But again, that's why you have to plan these things right at the very beginning. And then always evaluation. And so we tend not to do performance evaluations in simulation because when we're working with undergraduate students, we're putting them in situations where we're expecting them to function like a practitioner. So I'm saying, okay, you are a registered nurse. I want you to go do this. Well, they're not a registered nurse. They're a third-year nursing student. They'll say, okay, I need help. I say, okay, yeah, help's coming, but while you're waiting for it, let's see what you guys can do. Sometimes they do really well, sometimes not so much. I would say more than 50% of the time they surprise me because I think this is beyond what they can do. You let them sit there with their group of 4 or whatever and think it through. They will do things that you could not imagine. But in clinical, we can't do that. You can't let them try things out on a patient. So because of that, we don't actually evaluate the student in terms of their clinical performance. Because if we were to do that, they would ask, well, and rightfully so, how are you evaluating me? And then what they'll try to do is meet those criteria. They're not experimenting, they're not trying new things, they're not thinking, beyond the linear patterns that they're familiar with. That's why we don't do that kind of evaluation. But what we do need to do is you need to evaluate their learning experience, the facilitator's ability to facilitate and debrief, the realism of the scenario. There are other tools that are out there that are specific for just on debriefing. So whether you're looking at the debriefer or the student experience or the participant experience in simulation. So there are other ways to gather evaluation materials. If you're doing a study, then obviously you've thought of the end before you've even began. But at the same time, that's something a bit different. I think it was to Heather yesterday, I was saying, as the editor for the journal, I see a lot of papers that are kind of like a pre and a post test. And while those were important, and I've said this to a few people, if you design an intervention, an education intervention, even a half decent one, if I know nothing, I go through the intervention, I should know something afterwards. That's not groundbreaking. It doesn't have to even be a simulation. It can be, even a lecture class. So those are the kinds of things you have to think about more. So how is this going to change practice? How is this going to improve whatever it is you're doing? Are you looking at them a month later, 3 months later, 6 months later? In which case now you have to look at all these other confounding variables. So that kind of research and literature is right now still a little bit hard to find, but that's where we need to put our energies and our efforts. So not these one and done kind of activities, but more of how is this changing practice? How is this changing students' thinking, changing their learning experiences? Because I often, again, I can't remember who I said this to, my perfect world, there would almost be no lectures. Because honestly, like you and I were talking yesterday, you sit at the end of a lecture and you go home, what do you remember? Even from today and yesterday, I'll go home, you'll go home, you remember, oh yeah, I saw Nicole talk about something sim. Will you remember this slide? No, and that's okay. But that just shows you, if I actually put you, I don't know when you guys got hooked on sim. Sorry, now I'm on a big tangent. But when the first time I got hooked on sim was because I was in one. I was working with the military. I was down at a conference in Calgary with the Army, and they put us in the back of a bus and said, here's your cardiac patient, go. And I didn't know my peers that were around me. I didn't know even their clinical background. We killed him. I think he had an allergy to aspirin, and one of my peers gave him aspirin, and I kept saying, press reset, and they didn't. They let us go right down to the very end. Laughing, I have to admit, I heard that in the background. But I remember that, and that's when I thought, I love simulation. I remember this. I remember the leader, he was a retired fire chief. Well, of course he didn't know what to do, but yet he felt like he could be in charge and do this. I don't even remember the other people, I just remember him. But see, I remember that, and this is 20 years later. And that's when I realized this is such a powerful learning experience. Other than actually having the clinical experience, I remember that more than any class, any lecture I've ever had on MIs or anything else like that. So that's where you kind of think, okay, these are powerful experiences. How can we capture that? How can we capture that learning? And what do we want to do with that? And so that's where with the evaluation, it can be, there's so many things you can do, but you just have to start to always think about how you're going to capture that information, because that's the only way that we're going to make any real change, is by people building on the other work that previous individuals have done. So that's the whole process. So for that whole thing, is that going to be the same person? Oh, editorial problem. Those are not all the same people. Well, it should be all the same person. They're going to be groups of persons, but you're not doing it alone. That's what I'm trying to get at. This is not something that you'll do in isolation. Probably most of us tried, and then realized that we are just burning ourselves out. So who do we need? We need a little zoo. We need a team. And you have to figure out who's the right person to be on which part of the team. I don't want the smelly guy, but that's okay. So first you do need somebody who is, in terms of the development, you need somebody who is considered an expert in simulation design. So not all of us are good at creating simulations. Some of us are just, we kind of just, like I said, come up with the clinical scenarios. But other people are going to look at what are the course or the situational needs that we have for the program. They might be somebody who's doing the needs assessments. These are people who actually create smart learning objectives. If you're not familiar with those, then, learn or take a faculty development workshop or something like that. Or if you have people that you know are designing sims a lot, partner up with them. Because what they'll start to do is they'll start to give you a little bit of a template or a bit of a skeleton for your simulation activity that you want to run. So you need somebody who's an expert as a sim designer. You always need subject matter experts, because I might be a really strong sim designer, but like I said, I was working with a group that's community health, does community health outreach. That's not my area. And so I'll work with them and I'll say, okay, what are you trying to do? But when it comes time to actually looking at the context, or even pediatrics, if I have different medications, I'll have to run it by my peds people, because I don't know peds in a critical care area. So I'll have to involve them and they'll kind of go through that. Often the subject matter experts are the hard ones to kind of pull in. And that's because, we're all busy people, don't get me wrong. But it's just that they might not necessarily they want to run a sim, they don't necessarily want to be involved in all the nitty-gritty details, but you need them. You need them to be able to kind of, if anything, just validate your scenario. And sometimes they'll say, I just need you to read through this and make sure that and give them very specific things you want them to look at. Because I don't know about your templates, but my template is it can be anywhere from 4 to 8 pages long, depending on what they're doing, but give them specifics. I want you to look at these medications. I want you to look at this state of the scenario. So that way, am I off course? Are these best practices? Have practice changed? That kind of thing. If they come up with other kinds of objectives as well, by all means, get them to provide a little bit of feedback. Often what we'll do is we'll sit down with our SMEs and we'll just say, okay, just tell us, and we have like a research assistant or somebody who kind of types everything out, so that way then we can capture some of their thoughts and ideas. I guess what I'm saying is rope them in, but try to make them maximize the use of their time while they're involved in your sim design. It also lends credibility to your simulation. Okay, so we've developed it, we've now got to design the sim. So you're still going to involve your sim designers, because they're going to be looking at things like the moulage, like the charts, like the environment, like the fidelity, all that kind of thing. Because somebody needs to think about that. Somebody needs to think about the space. I don't know if you have a coordinator for your space, because it shouldn't be just booking. I have booked all this time. Well, no, you have to prioritize. So is this something that's part of a curriculum? Is this part of a research experiment or study? Is this part of just, continuing competencies? Is this, a CPD course? Like whatever it is. Because there should be priorities. We ran into that problem with we have multiple labs, but our main big lab it was kind of like a first come, first serve. And so we would have, let's say September 1, everybody would put out their needs. And so somebody would book whatever they wanted for the whole year. And then there would be other kinds of curricular things that we tried to introduce, and there was zero flexibility in the schedule. So we started to have to kind of prioritize it. And so we would say to people, especially if we had outside agencies that were using it, you're kind of like number 3, so you might get bumped, in other words. So they weren't too happy with that, but we don't have, again, infinite amounts of resources, so you kind of have to figure out where you want to fit everybody. Then we have our sim technicians, and they do things, if you're going to pre-program your scenario, even getting all that equipment together, all those other kinds of things. You need somebody who's going to be in that role to make sure that you've got the equipment that you need for your simulation. Starting to look at the fine details, because that's where, ideally, if you can run a pilot, that would be great, but that's when you get to see, okay, so what am I missing in this scenario? Any kind of equipment needs, what kind of staffing needs, do you need standardized patients, do you need embedded actors? Whatever it is that you need, you have to think about those things and then write them down. Okay, so now we're going to implement this. Honestly, without buy-in from administration, whether that's your coordinator, directors, whether that's program directors, whatever it is, you need to have buy-in for them for 2 reasons. One, they control the budget. So they will determine whether you have staffing for all those other kinds of things. But then also they will have a say in how embedded it is in your program. So even if it's within a hospital, this is probably where it's probably even more important in terms of whether it's something that you can use as part of, again, a one-off experience, or if it's actually embedded. So you need to make sure that they're on board. Ideally earlier, they're the ones who are very happy to say, oh, look, the foundation bought us a simulator. Here you go. Be so thankful. It's like, great. That's the cheap part, actually, because what happens is that now you need to have warranty, you need human resources to support this, you need disposables, like you need all these other kinds of things. And so obviously you need to have a budget for that. Ideally, you'll have a group of trained simulation facilitators. So with us, and it's part of the requirements, is you cannot go and facilitate simulation without going through a faculty development workshop. So I have a lot of clinical instructors say, I teach clinical. I'm good at that. I'm going to go and teach sim. No, because it's not the same. And so it can be, we have a half day that's on facilitation, another half day that's on debriefing, and that's the bare minimum that they have to attend in order to facilitate simulation. And if they don't, they can't do it. And so I actually had one clinical instructor who I had numerous amounts of workshops, and she was like, oh, I'm busy, holidays, kids, whatever, which is okay. I mean, we're all entitled to have holidays and children. But at the same time, it's just that after all of these things, it just wasn't a priority for her. And so then she was supposed to start September 7th or 8th or whatever, and it's like, no, you didn't come, so you can't teach. And so she wasn't, so now she didn't get paid because she wasn't there and she wasn't happy, but that's somebody else's problem because I'm not in human resources. But then we had other people that could kind of fill that in because we have a trained group of some facilitators. She was at the next one. So a little bit of incentive. But we told her this is what was going to happen. I guess she kind of figured that we were not serious about that, and it's what's interesting is we actually have, not a wait list, how would I say this? We have an oversupply of interested people who want to be sim facilitators than what we have roles for them because they really like teaching in simulation. So not a bad problem to have, which is completely different than even 3-4 years ago. So, and a lot of them are clinical instructors who see the students after they've gone through even just 3 weeks of sim and are now taking them into clinical, and they see the difference in the sim and they're like, what are you guys doing? Because these students are not the same students that I used to get. So now they want in. So I only need 3, not 10 out of the group. So they're not able to do that. Okay, so now we're actually going to implement the sim. And so, of course, we need our sim facilitators. The technicians, I cannot stress enough, nothing moves at all without your technicians. And so it's kind of funny. So we had the sim facilitator who was, not ready. We had a little group. We could easily fill them in. Sim technicians, these people have skills that you can't just fill in. And so these people are running the mannequins. They know how to troubleshoot. They are, the cameras, things like that. They can just come in and do that. And without them, we had cameras go down one day, I think it was like day 2 or 3 of our big simblets, and we panicked. We just didn't know what to do because we didn't have, our sim technician went on a pilgrimage to Israel or something, and we didn't replace them because we thought, oh, how bad could it be? It was bad because they're going to really make sure that things move in your simulation. Without them, you don't need as many as sim facilitators, but you need a core group that are really, really strong. Because when you have, especially you've probably had this, you're in the middle of a sim and something happens to your mannequin or something happens to your video equipment and you panic, right? It's like, we do not know how to teach without this. But it's because all of your activities are kind of wrapped up into that. And then you need a group of willing participants or of students who, well, willing meaning it's mandatory and they have to come. But essentially, they're ready. You've prepared them. You've done your pre-briefing. They've done their prep materials. And like I said, they've gone through the orientation of the learning environment. They know what's what. We actually created a couple of videos of, we call it like good sim, bad sim, but it's all focused on the sim participants. So how we don't want students to behave in sim and how we do want them to behave. And the don't are things like, oh, this isn't real. I don't know why we're doing this. What's the vital signs again? I don't want to press it. You know what I mean? Like those kinds of learners. And so we provide that for them the very beginning, so that way they're ready. They're ready to get in there and they're ready to learn. So now we're going to do the evaluation, and again, you need to have administration on board because there might be things that they're interested in knowing a little bit more about. They might have their kind of mandates, but connect with them. Find out what is it that they want to know. So if you're talking to somebody from an education program, they probably want to know, how is this impacting our the student learning experience, the student learning? Is it worth the expense of this? Because it is an expense, especially initially. Once things are moving, then it's probably a little bit less. But you need to kind of make sure that you're providing the data for the people who need it. Now, research, we're not all big sharks, but we're kind of always looking for, give us more information, more data. And so, but just be very deliberate with what we're trying to accomplish here. And so, whether it's, like I said, looking at learning outcomes, or it's looking at something more longitudinal, whatever it is, but always build that into your sim experience, whatever that looks like, because it's a lot easier to have all this data and then go back and say, oh, okay, yeah, we collected that, than to try to come up with it from the very beginning. So when we did our 25% pilot initially, we had looked at, we had student experience, student learning, so we did knowledge tests. We did their NCLEX scores at the very end, so the national exam. We did focus groups with clinical instructors who are with students in SIM and those who are without. We did focus groups with nurses who are working with students who were in SIM and those who are without. We evaluated all the scenarios in terms of their applicability. We had students rank them in terms of what they found were most helpful, beneficial, and not. We just had so much. And each term, I literally had a binder of data. And it was all superimposed into, we overlaid it to, the curriculum developer had a meta-analysis of all these, of best learning practices in education in general, just not the health professions. And so kind of teased all of that out. So it was a lot of work, but I'm still using it now. And some of it is from 6-7 years ago because it's just that rich. So make sure you continue to collect that. So how does it really impact learning? And so the biggest thing is for people, it's they're learning about learning. And like I said before, when we started to focus on why does simulation work, we actually started looking at learning in the health professions in general. And so if you look at just even the literature, the amount of articles that have been published on simulation compared to those in clinical or in the learning environment, the traditional learning environment, they're just like sky high, that you can't even compare them. And that's not a bad thing. It just means that what we're doing is we're actually focusing on education for a change. So many times we just kind of did it how we did it. It's like, what's to study? Maybe we have a clinical learning unit or a dedicated learning unit. Okay, that's great. But we're not really focusing on the learning. Whereas with simulation, we're able to do that right across the world, actually. We're kind of doing the same thing. There are people who are looking at return on investment, and this is, I can't remember which group it is. They have a bit of a formula. So they're looking at costs of the equipment and human resources and have kind of weighed that out. I wish I could remember. I want to say Western, but that's probably wrong. But yeah, there's different ways to kind of calculate that, so you can determine whether this is something that you are you're maximizing the investment. And it's also starting to put a value on teaching and learning. So many times I was saying to here at dinner the other day or lunch is, I don't know about you, but when I became an educator, I was hired, I was given an office, I was given a book, a syllabus, and a computer, and said, your students are coming in a month. All right. Don't know what to do, I'm a nurse. So I bought a plant, because that's what every office needs, it needs a plant. But I didn't know what I was doing, right? No one taught me. All the faculty development stuff was going to start in September when I started with my students. I think I was teaching growth and development, and I was so nervous, I went from preconception to 3 years of age within an hour. Because it was just like, blah, 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 blah. Any questions? No, next. Blah, 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 blah. And I didn't really take any kind of courses or anything on teaching and learning. Yet we expect the teachers for our children to be able to do that, but not for educators. And so that was kind of one thing that it's also, when you're working in simulation, you cannot get away from looking at teaching and learning pedagogy and philosophies. And so that's really important to be able to actually now put a value on teaching and learning in the health professions. So really, it's the biggest thing is it does take a bit of a village to create these simulation experiences. And this is something that I kind of mentioned briefly yesterday. We talk about Education 1.0, or many educators are doing Education 1.0, so the didactic, here's my lecture, I know everything. They talk about doing Education 2.0, which is a little bit more interactive. But what we really should be doing is more what they call now Education 3.0, where essentially the student comes to you with what their learning needs are. And that's what I mean by the student will see you now. They don't need to be in your lecture. Like even with my students, I say, if you're not here, if you're passing, obviously, if you're passing and you don't really need to be there, then what am I doing? What am I creating in the environment? It's kind of funny, especially if you guys have kids that play video games. I don't know about yours, but mine, they want a video game, so they play a video game. They take it out of or download it now, and then they don't read anything, right? They just play, they experiment, they go through here, they die there, they go there, the health levels go up or down or whatever. And then when they get stuck, what do? They go look at the cheats online. Wouldn't that be great if students could do that? Play with games, interact, do that kind of thing. And then when they got stuck, that's when they would go to do their readings and resources or come and see us when they had these problems. But essentially, that's the most self-directed. We always say, oh, self-directed, in that I give you a bunch of readings and I expect you to, expect you to do something with that. That's not exactly what self-directed is. It means that some person might need 2 minutes, some people might need 2 hours, some people might need 2 days. And that's okay. So just to kind of going on with this one, if you just Google Education 3.0, you'll see a template like this. But it gives you, it's looking primarily at the classroom. But you can kind of see how things have progressed. But essentially here, when you're looking at 3.0, learners, they're co-developers, co-researchers. They're not necessarily just you who's looking at that. It's the lifelong learning. Keep things open, keep things free. It doesn't have to be so narrow in terms of the learning. Involve them. Some people will involve students in designing the simulations. That, oh, well, that's going to give it away. Well, but they're going to learn in designing these things. So why don't you get them to help you with co-constructing some of their learning experiences? They're very, very digital, mobile people. That's why even with my students, it's always funny because people say, oh, I don't like the students in the back. They're sitting there on their laptops. They're probably on Facebook. My first thing is Facebook's for old people. That's what my kids tell me. The only people who use that. So they're probably not on Facebook. And then if anything, I was curious one day. I went to the back. They're online shopping. Whatever, that's fine. But whatever it is. But you know what? But they're passing and they're doing well. So, I mean, if they're online shopping, I don't want to say I don't care because I care, but that means that obviously whatever I'm doing is not enough to socially or to engage them in that learning. And so that's okay. That means I need to kind of change things up a bit, which is what I mean is why don't we have, like with my EIP, it's that 4-hour class. All the talky stuff is all done on the PowerPoint, and almost all of it is, and for things like qualitative, I'll say go for coffee and do your photo voice kind of thing and do some kind, and then when you come back and you've done your observations, that's what we're going to do an analysis of your qualitative data that you went and collected. So I send them off for a half-hour, 45-minute coffee, but they're working while they're doing that. They're observing. They're doing different kinds of things. Because that's where, learning locations, they don't have to be just in a room. They can be anywhere. So those are things that you kind of need to think about. How are you changing what you're doing to make the most of the whatever learning environments you have available to you? So really, and this is my last one, is the outcomes really are worth it. It's a lot of work, it is. But you will have improved student learning. Like even, I think of those voiceover PowerPoints, I looked at what I had, and normally, let's say, especially if you've already created them, you really only need to review them, update a few things. If you're going to do the voiceovers, now you have to type, for me anyway, I have to type everything out, what I want to say. That takes me a long time. Then I have to record it. That takes me another long time. and then post it as a video or whatever. So it probably takes me 3 times as long initially to do that, but really it is worth it. Then after that, you can kind of sort of reuse some of your things. But really it does make a big difference, because my evidence-informed practice class, believe it or not, is this term, they're telling me it's one of their favorite classes. That never happens. They don't like research methods. Like even the folks from PT yesterday, they said their students don't like that. And it's true, because they think like, that's not what I came here for. Either that or they just like the 45-minute coffees. I don't know yet, but it could be that too. But it does increase your collaboration, because I might not be an expert in something, but one project I'm working on with education psychology, computer engineering, medicine, nursing, and counseling. A great group. A lot of them, you meet by happenstance, but they contribute a lot more to what you're doing. You're able to use simulation as your knowledge translation products. And so that's where we're trying to include a lot more sim, is in terms of not just publications and presentations, but let's create almost like a sim to go that people can use with their knowledge translation products. And so we've had, especially some of my colleagues have had a lot of success where the knowledge, when they write their grants, people are saying, oh, this is really creative and innovative. We really like your KT outcomes. And that's really helped boost some of their productivity. Hopefully, again, we have to collect that data because we want to enhance patient safety. And then in terms of patient education, you can use simulation also to educate patients. It doesn't have to be just something that we use for healthcare providers. So something to think about how we can use it in other ways as well. And this is something a group out of McGill is starting to use a lot more sim in terms of patient education. So that's it for me. I didn't leave a lot of time for questions, but hopefully if you do have some, we do have a bit of time. Good.
I'm probably coming from a different perspective, but I'm involved in sort of course development at undergraduate health sciences level. And we're starting to do a lot of blended flipped classrooms, but originally we're starting from a purely online environment. So in terms of your list for simulations, the pre-briefing and preparation, what's the best way to engage faculty members to understand there isn't some pre-briefing or materials that they could convey to students before their blended learning classroom? Like, is there some strategies, or how do you, what's the buy-in? How can you sort of encourage them to think about that?
About pre-learning activities in an online environment. Do you mean to get them to understand the importance of them, or to just do them?
Yeah, I think a lot of the instructors, it's kind of backwards, because they have been giving on-campus lectures, right. And then we develop purely online courses with them, and then we bring them back into sort of an on-campus blended environment where some material is online and some is on campus. So I think the area that I'd like to encourage them is to think about, okay, they have small group learning in person with the students, and how can they best sort of prepare those students for a new type of learning that they might not expect from an on-campus program.
And that's interesting, because online learning we think just means taking the classroom and putting it online, and that's not what online learning is. And so I don't know if they go through any kind of faculty development, or if they just say, here, help me put this online, because that's what some of my faculty do, is this, here, we call it CATL, the Curriculum or Center for Advanced and Teacher and Learning or something like that. And they just kind of make the magic happen, and then they say, oh, I'm online. Well, for example, even doing a voiceover PowerPoint and putting it online is not online learning. That's just moving things around. But I think if you kind of lay out the things that they need to do, a lot of times it's not that they don't want to, they just don't know what they should be doing. But what's interesting, and not to out Marion, but Marion creates, especially for simulation, she creates these great video games that are all meant to be preparation and pre-briefing before they start the simulation. So even though it's a bit different than your classroom, I think if you had something like that online, whatever learning they're doing, then do a game as a pre-brief, something interactive, something that's useful to them, and then bring them together online or in person. And it doesn't even have to be like what Marion's work is kind of like, it reminds me of those choose your own adventure books, where it's like, what are you going to do here? What are you going to do there? But they have like a clinical application, right? But it doesn't even have to be for healthcare. You can use it for anything, really. But you've got somebody here who's an expert in that. So I wouldn't say like, talk to Marion, but seriously, kind of see what, yeah, but seriously do that. Because like I said, a lot of times it's that people don't know what to do. They don't know how to do it. And I know we're all busy. I mean, the only people I know that are not busy are 6 feet under. But, you know, outside my office, I have a sign that says, stop the glorification of busyness, because everybody's like, oh, I'm too busy for that. But, you know, if you're interested in education, if you're interested in student learning, you'll make the time for those kinds of things. So just kind of, sometimes people, you need to support them a little bit more until they kind of get ready for that. But, and then take it from there.